I'm Dr. Cannon, a general pediatrician and international board-certified lactation consultant at Lakeside Pediatrics in Lakeland, Florida. I've been getting a lot of questions about infant feeding during the coronavirus pandemic, and I'd like to share some of those answers with you today. First and foremost, breast milk remains the best and safest form of nutrition for all babies. It has been shown that the coronavirus does not enter breast milk and cannot be transmitted to infants in this way. The World Health Organization recommends that everyone breastfeed and continue to breastfeed during the pandemic. You do not have to stop nursing your baby after the age of 1 year. In fact, I nursed my daughter until she turned 3, and in many third world countries, it's recommended that women continue to breastfeed even much later. While after the age of 1, breast milk is not the primary source of nutrition, it can continue to provide excellent antibodies to help prevent and fight infection. If you're pregnant, now is a great time to learn about the benefits of breastfeeding and what to expect in those first few days and weeks. Talk to your midwife or doctor about what you'd like to do. While we can't meet to have a face-to-face breastfeeding class, you can get lots of great information online. FirstDroplets.com and the Leche League are excellent sources. Your local WIC office may also be able to provide some information. If you happen to have the coronavirus infection when you deliver your baby, you can and should still provide breast milk to your infant. You may be separated from your newborn, but you should ask for a hospital-grade pump and start pumping within an hour after delivery. Keep pumping around the clock every 2 to 3 hours. Wear a mask, keep surfaces clean, and wash your hands thoroughly before touching bottles. Anything you pump can and should be fed to your baby. Keep nursing after you leave the hospital. WIC offices are open for help over the phone, and I know lots of IBCLCs that would be happy to help you over the phone. Telemedicine is an option for many of us, and there's a lot we can do through video. Unfortunately, a lot of women are unable to breastfeed. Adoptive families and foster families must rely on formula. I'm under the understanding that a lot of this is disappearing from the shelves, much like toilet paper. Please only take what you need. These babies need to eat. I have heard that the warehouses for the grocery stores and the formula companies have lots of formula to restock shelves. You just need to give them a chance to do it. If your baby's on a specialty formula because of milk protein allergy, like Elecare, Alimentum, or Nutramigen, you should continue with these formulas. You also should not transition to soy formula since there can be cross-reactivity for those with milk protein allergy. If you're on another specialty formula, like Reguline, AR, Gentilese, your baby may tolerate a different formula. You can potentially go back to regular basic infant formula without much issue, especially in the short term. If that's all that's available, that's okay. The brand of formula also generally does not matter. The regulations on infant formula are so strict that many of them are almost the same. So don't worry if you can't find the brand that you typically use. Remember, it's important to keep mixing formula correctly. It's generally 1 scoop to 2 ounces of water. Don't skimp on the powder, as this can be very dangerous by causing electrolyte changes in the formula and harmful to babies. If you mix extra formula for a higher calorie content, talk to your doctor before you make changes. Your baby may be growing well enough now that you don't have to use as much formula, but you need to speak with your pediatrician before making these changes. I've been asked a lot about homemade formula. This is not safe. The protein balance and electrolyte balance in formula is really important, and if it's not done correctly, can cause significant harm to your baby. If your baby's over the age of 4 months, you might want to consider introducing solid foods. Breast milk and formula are still the primary source of nutrition, but solid foods can be helpful. Start with soft foods, bananas, avocados. You can mix any cooked vegetable together with breast milk or a little bit of formula. Go slow, but have fun with it. Remember that infants over 1 year should not have honey, whole milk, or juice. Infants over the age of 6 months can start having a little bit of water with their solid foods. This is a difficult time for everyone. Don't be afraid to call your pediatrician and ask questions. We're here for you. We're still working, and we're doing the best we can to answer all phone calls. Many of us are starting to work with telemedicine, so reach out and let us know what you need. The local WIC offices are also still open and doing a lot of work by phone, so call them, reach out to them too. Stay inside, wash your hands, and remember we're all in this together.